Quality is essential for effective health service delivery. As healthcare consultants, you will need to be versed in helping organizations identify where they can improve service quality. You will have to be prepared to provide training in quality improvement approaches and lead and coach staff to systematically implement continuous quality improvement. As quality management consultants, your focus is on changing healthcare systems to provide better care, that is, patient-centered, reliable, safe, and accessible care, healthier people and communities, that is, supporting evidence-based interventions that address the behavioral, social, and environmental determinants of health, and lower costs, that is, reducing the cost of healthcare to all stakeholders. If you're going to be an effective quality improvement consultant, you will need to be able to define quality from multiple perspectives, including those of the patients, the providers, the employers, and the insurers, translate the needs of the patients into subjective quality measures, transform the voice of the customer into process measures and quality indicators, use quality improvement tools, view quality as a continuous process, and finally, understand how to introduce and develop a quality improvement process in an organization. Understanding quality from the perspective of the customer is an important skill. You will need to become familiar with survey methods that build your understanding of the voice of the customer. How the customer experiences quality is a mix of factors related to the health system. There are tangibles, which are physical facilities, professional appearance, personnel, equipment. Reliability, the ability to perform the promised service dependably and accurately. Responsiveness, willingness to help customers promptly. Assurance, the knowledge and courtesy of employees and their ability to inspire trust in their patients. Empathy, caring, and individualized attention given to patients. As a consultant, you will also have to fully understand the way care is delivered and be able to translate patient needs into objective quality indicators for structure, process, and outcomes. Structural indicators are input measures like material resources, human resources, organizational structure, information management, and leadership. Process indicators describe how the process is being performed. They include indicators like time, evidence-based care, documentation, and safety. And outcome indicators, which measure such things as the patient experience, hospital-acquired infection, readmission rates, mortality rates, morbidity, and complication rates. To build your consulting skills in this area, you should learn to use as many quality improvement tools as you can. And here are some of the most useful. Voice of the customer, that informs you about customer needs. Voice of the process, which include process measures. Flow charts, that are graphic representations of workflow. Check sheets, that track occurrences and organize issues by category to identify critical problem areas. A fishbone diagram, which will help you do a root cause analysis. A Pareto chart that prioritizes problems based on the 80-20 rule. A control chart that depicts the process through continuous tracing of performance with upper and lower control limits displayed. A run chart that tracks values of an indicator over time to detect emerging patterns. And finally, and very importantly, the PDSA cycle, or a continuous improvement cycle. Finally, you will need to become familiar with and use and be able to coach others to use a number of quality improvement approaches, such as Lean, Six Sigma, and continuous quality improvement. Lean is a set of concepts, principles, and tools used to create and deliver the most value for customers' perspective, while consuming the fewest resources and fully utilizing the knowledge and skill of people performing the work. Six Sigma is a process improvement methodology that focuses on eliminating defects and decreasing variation. It refers to 6 standard deviations from a target and is the trademark name of a methodology for process improvement using DMAIC: define, measure, analyze, improve, and control, which is a data-driven error reduction process. So let's get going. Let's build our quality improvement skills and start to help our clients solve some of their important quality improvement challenges.